New at 6, the use of radiation-based imaging has risen dramatically in the past decade. Medical radiation now accounts for a significant proportion of all radiation exposure in the U.S. Critically ill patients are often subjected to many CT scans and X-rays. But who is keeping track of when enough is enough? Ursula Perry has that story.
When he noticed one of his patients had undergone 100 X-rays, Dr. Sodir Kushnan was concerned.
I said, surely someone is keeping a track of this. Some regional, local, or national authorities keeping a track on the amount of radiation exposure a patient typically gets in. And I realized that wasn't the case. There is nobody.
There is a standard federal limit for radiation dosage, but a recent Cleveland Clinic study revealed something shocking.
Some exceeded a number of more than 100 millisieverts within these 6 days. By federal occupational standards, that dose cannot be exceeded in 5 years, and we have that happening in 6 days.
As patients move from different facilities, the information about radiation they have received is not transferred, which could lead to...
Patients could develop a certain kind of cancer because they've been exposed to a certain amount of radiation.
X-rays, CAT scans, and fluoroscopic surgery are the most common sources of radiation, but Dr. Charles Martin says something needs to change.
Improving communication amongst the multiple specialties to see if there's one way to get many pieces of information from one study.
So talk to your doctor and be sure to ask.
If there is no suitable alternative and it's absolutely necessary, then one would have to weigh the benefits versus risks and proceed with what's required.
Ursula Perry, KSAT 12 News.
The Cleveland Clinic is now working to develop a tool that tracks radiation doses and uses our electronic medical records as a home for all that information.